Hi, my name is Rosana Navarrete Verdugo. I'm a student at Catholic University. I am going to talk to you about ZIKA virus complications. Definition: Zika virus disease is caused by a virus transmitted mainly by mosquitoes of the Aedes genus, which bite during the day. Symptoms frequently mild and lasting 2 to 7 days. Constant in fever, rashes, conjunctivitis, muscle and joint pain, and headaches. Most infected people are asymptomatic. Zika virus infection during pregnancy can cause microcephaly and other birth defects, which can cause congenital Zika virus syndrome. The infection is also associated with other complications of pregnancy, such as preterm labor and miscarriages. Infection is associated in children and adults with an increased risk of neurological complications such as Guillain-Barré syndrome, neuropathy, and myelitis.
Zika virus is a flavivirus. It's an infection that's carried by mosquitoes, and it causes an illness that's usually very mild. It can even be asymptomatic. One of the reasons that the Zika virus is of so much concern lately is not from the infection itself, but of the late consequences, particularly in pregnant women. So this is what has caused the largest degree of concern. Congenital abnormalities that have been linked to infection of pregnant women with the Zika virus, and that has later effects on the fetus. In terms of a vaccine, we don't have a vaccine for this disease either, but there are several candidate vaccines that are in research stages right now. And we're hopeful that perhaps within a year or so, we'll have some clinical trials ongoing with vaccines to prevent this disease. So at Johns Hopkins Medicine, we are well positioned to address many aspects of an infectious disease threat like the Zika virus. For instance, at the Bloomberg School of Public Health, we have many researchers who are doing vaccine development research on similar diseases like dengue, and these efforts could be repurposed to develop vaccines for Zika virus infection to prevent the infection. From a patient care perspective, we also have infrastructure in place to screen our patients for recent travel. So I think when facing any infectious disease threat like the Zika virus, it's important to remain calm and to arm ourselves with the facts. And the Centers for Disease Control and Prevention is an excellent resource to get information and to stay abreast of the current advisories and recommendations to protect ourselves.
Applications in medicine. The infection can be suspect from the symptoms in people who reside or travel to areas where there is transmission of the virus and or vector mosquitoes. However, the diagnosis can only be confirmed by laboratory tests or samples of blood or other body fluids, such as urine or semen. There is no treatment for Zika virus infection or the disease it is associated with. The symptoms of the infection are usually mild. Patients with symptoms such as fever, rash, or arthralgia should be at rest. Drink enough fluids and take common pain and fever medications.
Today, we're looking at the symptoms, diagnosis, and treatment of Zika. Anyone who lives in or travels to an area with Zika and has not already had the virus can become infected with it. In many cases, Zika doesn't cause any symptoms or causes only mild symptoms that last several days to a week. Hospitalization is uncommon. Typical symptoms include fever, rash, joint pain, and red eyes. Some people will also have muscle pain and headaches. If you've traveled to an area with Zika and experienced these symptoms, schedule an appointment with your doctor or other healthcare provider to see if you have Zika. Diagnosis of Zika is based on your recent travel history, symptoms, and a blood or urine test. Your doctor or healthcare provider may also test for similar diseases like dengue or chikungunya. Right now, there is no medicine or vaccine for Zika virus. If you develop Zika symptoms, make sure you rest, drink fluids to prevent dehydration, and take acetaminophen, found in products like Tylenol, to reduce fever and pain. To help reduce the risk of bleeding, don't take aspirin or other non-steroidal anti-inflammatory drugs until dengue can be ruled out.
Pros and cons. Pros. Preventive measures can be taken most of the infect to do not get complicated. Cons. There is no specific treatment. Associated disease can develop.
Here are effective steps you can take to protect yourself, your family, and your community from the spread of Zika virus. Cover and repel. Remove collected water. Keep mosquitoes out of your home. And, if you're pregnant and have sex, use condoms. All of these actions are necessary. Taken together and repeated as recommended, these steps will help protect you, your family, and your community from getting Zika. Cover and repel to keep mosquitoes from biting you. Wear long-sleeve shirts, long pants, and socks, apply mosquito repellent, and sleep under a bed net and cover cribs and strollers with mosquito netting. Remove containers that collect water to eliminate places where mosquitoes can rest and lay eggs. Empty collected water at least once a week and scrub containers to remove mosquito eggs. Cover containers so they don't collect water when it rains. Throw away trash or unused containers with collected water. Keep mosquitoes out of your home. Use screens on windows and doors. Once a week, empty and scrub all containers inside your home that hold water, like vases or flower pot saucers. And use an indoor flying insect fogger or spray insecticide to kill mosquitoes. Zika virus stays in the body for a while and can be sexually transmitted by a man to his sex partner through semen. If you're pregnant, Zika can harm your pregnancy. If you are pregnant, use a condom every time you have sex with a male partner during your pregnancy. Use a condom the right way to prevent the spread of Zika virus. Using a condom can protect your pregnancy. If you're not pregnant and not trying to get pregnant, talk to your healthcare provider about effective contraceptive measures. Zika can be scary, but remember, you can take steps to protect yourself, your family, and your community from the spread of Zika virus. Cover and repel. Remove collected water. Keep mosquitoes out of your home. And, if you're pregnant and have sex, use condoms. For more information, go to cdc.gov/Zika.
Issue applied in Ecuador. Ecuador, like most countries in the region, reported the presence of the virus in late 2015. 1 year later, December 2016, according to information provided by the Pan American Health Organization. 48 countries in the Americas reported suspect cases of the disease, of which more than 100,000 were confirmed cases. Likewise, 22 countries reported the presence of around 2,500 cases of congenital syndrome associated with the Zika virus.
Ecuador has confirmed its first Zika case in a pregnant woman. The woman, aged 19 years, is in her 27th week of pregnancy. According to the country's National Institute of Public Health Investigations, the woman's baby is not at risk of being born with microcephaly, a disease that affects newborns.
We have confirmation for the first pregnant woman with ZIKA. This woman is at 27 weeks gestation, which would make her outside the high-risk time period for her baby to have microcephaly, because it's been determined that the risk is much higher, up to 14 weeks.
The country has confirmed 22 cases of the mosquito-transmitted virus, and concerns are running high that the disease could spread due to the weather patterns.
Considering we are facing an El Nino phenomenon, the amount of precipitation and the temperature has increased in the region where the vector is present. So, in light of this, the amount of vector we are going to have is much more elevated.
The World Health Organization recently declared the virus a global emergency and anticipates it to affect as many as 4 million people this year.
Conclusion. Zika virus disease is generally asymptomatic or has mild symptoms. However, it has been associated with the possibility of developing associated disease, mainly in newborns of women infected during pregnancy. There is also a risk of sexual transmission in both women as in men.
The Zika virus, suspected of causing birth defects, is now in 26 countries and territories in the Americas. 2 new cases in Florida now bring the total in the U.S. to at least 53. Zika is most often spread by mosquitoes, but today the CDC put out new guidelines aimed at transmission through sex. Our Dr. John LaPook is in Brazil, the country hardest hit by the outbreak.
Today's CDC guidelines say men who live in or have traveled to a country with a Zika outbreak should abstain from sex or use condoms during sex with pregnant women. Zika virus testing should be offered to all pregnant women who have been to affected countries. If they have symptoms, testing should be done within the first week of illness. CDC Director Tom Frieden.
We're looking to increase the number of women who are intensively monitored by their healthcare provider if they're pregnant to see if they have any indication that they might have this infection.
The main cause for concern in pregnant women is the suspected link between Zika infection and microcephaly, babies born with a small head and possible brain damage. Health officials in Brazil say more than 4,000 babies have this serious birth defect. The CDC is telling doctors in the U.S. to be vigilant. Dr. Nancy Kostler is an OBGYN at University Hospital's Case Medical Center in Cleveland.
Once microcephaly starts to develop, we can't fix it. It's not like having hypertension in pregnancy or diabetes in pregnancy, where we know what to do to get best outcomes for babies whose moms are affected by those diseases.
Today, Brazilian researchers reported finding the virus in urine and saliva, but that does not mean Zika infection can be transmitted by those fluids. Scott, Zika is still predominantly spread by mosquitoes.
John LaPook covering Zika for us in Brazil tonight. John, thank you.